I work with industry. I wanted to let you know that with my disclosures. There's too many here to read, but with respect to those that work on neuromodulation, I have worked as an investigator and a consultant for several of the neuromodulation companies. So please bear that in mind. I thought what I would do is talk about those devices that are cleared in the United States, talk about where they are with respect to Ireland and the EU and the UK, and also how they work and where I would use them in practice, and talk also about access. In talking about these devices, they are all portable and they are non-invasive. And the FDA, the US Food and Drug Administration, has designated them as non-significant risk. And that means they don't have significant side effects. So that makes them different than medications. And if one is doing a risk-benefit analysis, these don't have significant risk, but they do have benefit. So the fact that it's difficult to access them and that governmental regulation, government payers and private payers are reluctant to pay for them, it very, very much upsets me, because I think these really represent an important therapeutic option for people. And I do use them for my patients. Some of them are approved for the acute treatment of migraine or other headaches. Some are cleared for the preventive treatment, and some for both. And I'll cover the ones that you see here. The external trigeminal stimulator Cefaly, the single pulse transcranial magnetic stimulator Savvy, the non-invasive vagal nerve stimulator GammaCore, the remote electrical neuromodulation device Nerivio, and the combined occipital, supraorbital, and supratrochlear nerve stimulator Relivon. And all of these cleared in the United States. So I'd like to begin with the first one that was cleared in the United States. And the FDA designates the approval of these as clearance rather than approval. It holds approval for medicines and clearance for devices. Cefaly was the first that was cleared by the FDA, and it works for both acute and preventive treatment. And I put both the preventive evidence and the acute evidence on this slide. A study that John Shernan published 8 years ago was a study of people who turned on the device. You can see in the bottom right that it sits on the forehead on a sticky electrode, and people turned it on with 2 pushes of the button for prevention. And it turns on for 20 minutes and gradually ramps up. And that dose of 20 minutes nightly is the preventive dose. And over 3 months, a significant number of people had a reduction in their migraine days every month. In the acute setting, people hit the button once and it turns on a different program for an hour. And in a study that brought headaches down over the hour, and it can actually be repeated a second time for a second hour. And so in 2017, the FDA cleared it for both preventive and acute treatment. And as of October of last year, the FDA ruled that no prescription was necessary to purchase the device, which had been the case in Canada and which is the current case in Ireland. Now, in a few words about the side effects, remember there are no significant side effects, but I can tell you that everybody feels strange numbness tingling over the forehead when they turn this on. Some people find this unpleasant and get pain. And the intensity of this, which, as I said, ramps up across time, can be so significant that in the studies, there was quite a bit of dropout in terms of people continuing to use it. We've learned to coach patients to let it ramp up for 5 minutes, nightly for a week, and then 10 minutes nightly for a week, and then 15. And if one introduces it gradually, then people can tolerate it. And it is available in Ireland without a prescription. The company, Cefaly, which was a Belgian company, was bought by a private equity company in Toronto a couple of years ago. The dual device generally costs, the dual device meaning that it has both the preventive and the acute capability, costs close to 400 euros one time to own. And in the United States, there is a monthly payment option, which I hope is available in Ireland. And it costs about 20 euros every 3 months to replace the electrodes. The advantage of Cefaly is it has both an acute and a preventive effect, and that no prescription is necessary. The disadvantage is that for a lot of people, it does take time to get used to it, to get to the nightly dose of 20 minutes. And then the person really does need to wear it every night for 20 minutes for 3 months to get the benefit. But I do prescribe it a lot. I don't need to write a prescription anymore, but I do recommend it a lot because most of my patients can afford one time that amount or pay on a monthly. And I like the fact that it can be used both preventively and acutely. And I have a lot of patients that like Cefaly. Now I'll move to STMS, also called spring TMS, also called Savvy, which is a single pulse transcranial magnetic stimulator. And this is what it looks like. And it can be plugged in and charged, as can Cefaly, by the way. And a person puts it on the back of the head after booting it up and presses a button, and a magnet pulses the back. And the therapies include pulsing it 4 times in the morning and 4 times at night for prevention, or pulsing it 2 to 4 times to terminate an attack. An initial study on this 11 years ago by Richard Lipton evaluated whether it could stop an attack with migraine with aura, and it worked better than a sham. So at that point, the FDA cleared it for acute treatment, and then subsequently preventive treatment where it's pulsed 4 times twice daily for prevention was published. And people who participated in this had anywhere from 4 to 25 headache days per month, so episodic and chronic. And it did appear to lower the number of monthly migraine days, and the side effects were negligible, minimal, so it was a non-significant risk device. So it is cleared for both acute and preventive treatment. Now, technically, it's not licensed in Ireland, STMS, but it does have an EU CE mark. So it's had that since 2011. And I'm aware that patients have been getting it from the UK, but rules will be changing with Brexit, and the UK is going to require their own CE mark. But for now, the EU CE marks are recognized by the UK until 2023. There was a fall off for this device, which I'm aware of, in which the company went bankrupt. And this was in last August. But it was acquired by a new company. It was rebooted as the same name, eNeura, and the devices are available again. For the patients that were using the device, the cost remains the same, but it's high. It's over 2,000 euros per year if paid in full at the beginning of the year. And this is for patients who were already using this device for prevention and for acute treatment. However, for new patients, the cost will be over 300 euros per month. And there is an initial cost of about 1,000 euros for the first 3 months. And that is pretty steep, and a lot of people cannot afford this. The advantages are that it works, that it works both preventively and acutely, and it's quite convenient to hit the button and get a magnet pulse. And my own clinical impression is that it works well both acutely and preventively, but the disadvantage is it's a relatively heavy device, not very portable, and the cost is a very significant issue. But it is available at the very least through the UK. Next, I'd like to talk about the GammaCore device, also called the Sapphire device. This is a non-invasive vagal nerve stimulator. And you can see it here. It looks like an old-fashioned electric razor, and it non-invasively stimulates the vagus nerve through the neck. And it can also terminate aura. It requires that a gel be placed on top of these electrodes for each use. And each time that it's turned on, it stays on for 2 minutes and the lip twitches. And then repeated stimulations of 2 minutes apiece are necessary for various kinds of treatment. It works preventively for migraine, and the FDA cleared this based on a study in which people gave 3 cycles of 2 minutes 3 times a day. And Chris Diener published this a couple of years ago in Cephalalgia. It's interesting that the primary endpoint for some of these studies for devices were not significant, but that the regulatory authorities decided that the overall evidence for effectiveness was there and that the side effects were minimal. And so they did clear it, both CE mark in Europe and cleared in the US. And occasionally somebody will get a little throat discomfort or dizziness or sight discomfort, but really it's very well tolerated for migraine prevention. It's also cleared for the acute treatment of migraine. And in the acute treatment of migraine study, people would stimulate within 20 minutes of migraine onset and do 2 2-minute stimulation cycles, and then repeat at 15 minutes if needed, and then at 2 hours if needed. And again, in the main study, which was done in Italy and published by Cristina Tassarelli 3 years ago, the primary endpoint was not positive, but the preponderance of evidence was that this device could terminate migraine acutely with this protocol. And so the EU and the US both cleared this device for the acute treatment of migraine. The kinds of side effects I mentioned, a little bit of application site discomfort or sore throat or dizziness, but pretty mild. It is the only device that's also approved or cleared for cluster headache treatment. And it is cleared for the acute treatment of episodic cluster headache attacks, in which people with cluster do 3 2-minute stimulations and then they can repeat. And there were 2 studies using a sham-controlled device for this device for cluster, and both of them showed, interestingly, that the device worked to terminate episodic cluster headache attacks, but not chronic cluster headache attacks. And so the clearance is for the treatment of people who get 3 months off from their clusters at least once a year. And if they meet those criteria, then this device can work very nicely to terminate cluster attacks. It is also cleared for the prevention of both episodic and chronic cluster headache. And it was studied in the EU. Charlie Gall was the senior author of a study published 5 years ago, in which the device was added as 3 2-minute stimulations twice a day to people who were already on preventive treatment for cluster. And the addition of the device reduced the number of cluster attacks and reduced the amount of sumatriptan and oxygen that people were using. And it was pretty significant improvement. So based on this, it has been cleared for this indication. So it's cleared for acute treatment of migraine, preventive treatment of migraine, acute treatment of episodic cluster, preventive treatment of cluster headache when it's added to medications. And interestingly, the FDA cleared it for emergency use for adult patients with COVID who have asthma-related trouble breathing or reduced airflow for whom therapies were not adequate. And that is an ongoing use of this device. And it is also being tested in other therapeutic areas. But it's not easy to get. It does have a CE mark. It can be obtained from the UK. It is widely available elsewhere in the EU, for example, Italy, but it's quite expensive. It costs 500 euros per month for unlimited stimulation. There's no private coverage for this device in the United States. And interestingly, the military and the veterans groups in the United States do pay for this device. And so our veterans and military who want to use this device for migraine and cluster can get it relatively easily through those systems. And that's what kept this company afloat, because so few patients can afford it without private payer. So that's where GammaCore sits. Again, the only one of these is that I'm discussing where it's easy to get in Ireland is Cefaly. Let me move on to Nerivio. Nerivio is a remote electrical neurostimulation device, and it sits on the arm, as you can see in this woman, and it's held on with an elastic band. And then it is turned on with a smartphone, whether an iPhone or an Android. And there's an app that people download, and when the device is turned on, it turns on for 45 minutes, buzzes the arm, doesn't hurt, and it works extremely well in achieving a pain-free response within 2 hours for terminating migraine. And it also reduces pain. It also reduces pain without getting people entirely pain-free. It has sustained effect. It has relief of dislike of light and noise and nausea, all the usual ways. And if you look at these numbers, it looks quite similar to a triptan in terms of terminating a migraine, but no drug, right? No side effects. We evaluated real world data, because people can upload data with this device to the cloud. And we evaluated 1,339 devices that were prescribed by headache medicine providers. And for those that were prescribed by us, 60% pain relief in more than 50% of the attacks was reported, and 20% pain-free in more than 50% of the attacks. So a very, very large number of attacks, a very, very large number of devices. People kept using it. They found it beneficial as an acute treatment. And we use this quite a bit. And one of the reasons that we use it quite a bit is that it's not expensive initially. It's not yet available in Ireland, but negotiations are underway to make it so. As I said, the device is activated with a smartphone app for 45 minutes for each acute treatment, and each device has enough juice to treat 12 times. So 12 acute treatments, then you throw it away. In the US, there's an entrance plan in which for $8.50 in terms of euros, so a little over €8, you can buy the first prescription. Anybody can buy the first prescription for a little over €8. And that's an opportunity to try it for 12 migraines. After that, it's about €85 per device thereafter. And if somebody has 3 or 4 migraines a month and uses it 3 or 4 times a month, then it's going to last for 3 months. And people think that that is a reasonable price to pay to use it. So the Advantage is a great access plan. It has this cloud-based program to gather information if people want to participate in that. Disadvantage is it's acute only, and it's only good for 12 treatments, but we do use it a lot. Finally, I'll mention the Relivon device. This is a combined supraorbital, supratrochlear, and greater occipital nerve stimulator for the acute treatment of migraine. And you can see it over there. It looks like a little bit like a crown, and it sits over the same nerves that Cefaly stimulates, but also sits over the greater occipital nerves in the back. And there have been multiple randomized sham-controlled trials for this device. And long story short, it works very well to terminate migraine. You can see the pain-free results there are very, very good, probably even a little bit higher than for Nerivio and definitely higher than for Cefaly and for STMS. So it works very well. And based on this, last month, the device was cleared for acute treatment in the US. People put it on and leave it on for anywhere from 45 to 60 minutes to terminate migraine attacks. So it's cleared for use in the US, but not yet available. It's not licensed yet in Ireland or the EU. Cost and access are unknown, and everybody's scrambling to figure out how we're going to be able to get it for people for acute treatment and where we'll use it. But exciting that we have a new device coming. How do these devices work? Well, one way to think about it is here's your brain, and what these devices do is they go on different routes into the brain to turn down the migraine, whether acutely or preventively. For example, Cefaly, which is in the front, Relivon, which is front and back, ride in the front on the first division of the trigeminal nerve and then go down into the brain to modulate migraine downward. The GammaCore vagal nerve stimulator comes in on the vagus nerve and goes into the brain to modulate the pain downward. The magnetic stimulator and the vagal nerve stimulator both work in the middle of the brain on the thalamus. And in the case of the magnetic stimulator, the pulse just goes forward to inhibit the thalamus. And the thalamus is the railroad crossing for all of the sensations of the head. The Relivon device also comes in at the back, and that's where people get occipital nerve blocks or have occipital nerve stimulators. And that comes in on a different pathway that it comes up from the neck. And in the case of Relivon, there's hope that it synergizes it. You get the front and the back to terminate attacks. And then the Nerivio works by a completely different mechanism called conditioned pain modulation, which is a reflex that goes up from the arm and then inhibits the migraine. And the buzzing does not hurt, but it activates pain pathways so that pain in location A inhibits pain in location B. So it activates those pathways without causing the pain and inhibits the migraine. Some very clever ways of getting in to alter migraine and make it less bad. When do I prescribe non-invasive neuromodulation? Well, there's so many ways that it can be helpful. Early in somebody's migraine career, when they are young, when they have episodic migraine, when they don't want medications, these are great. And if I talk to a young person who doesn't want medicines and has disabling migraine 3 or 4 times a month, they're very enthusiastic about not having to take medicine. The other end, late in a migraine career, when multiple medications have failed, neuromodulation can work well. And Peter Goatsby talks about this, and he says, when we give medicines, we are aiming at particular chemicals in the brain. And often people don't respond to that particular medication, and that particular chemical is not playing a role. But with neuromodulation, we're inhibiting the nerves, all of the targets we know about and the targets that we don't know about. And that's why even when multiple medicines have failed, neuromodulation can work very well. I prescribe neuromodulation in a person who's planning to get pregnant. And we know that migraine is primarily, the demographics of migraine are that of young menstruating women and people who are planning to get pregnant. We discuss this often in my office, almost every day. And if somebody is planning to get pregnant in the next 6 months, these devices can help prevent migraine, can terminate migraine, can be used during pregnancy. In the UK, the transcranial magnetic stimulator is actually approved by the NHS for use in pregnancy. So that's a very good time to use them. They can be used as an add-on to medication. Somebody who is not getting adequate medication results, or the medication results are inconsistent. There's no reason why you can't put a non-invasive neuromodulation device on top of a triptan to terminate an attack, or on top of an anti-inflammatory to terminate an attack, or in a situation where a person knows that the medicines aren't going to work. And some patients really prefer to not take medication. And it's really important for providers to listen to what people want and to respond to that. So that if people can afford these devices, I strongly recommend them. And as I said, from a risk benefit analysis, they have no risk and they have benefit. So I think they are extremely useful for patients. And it's time for us to lobby our payers, whether they be governmental or private, and say these devices are less expensive than many of our medications. They represent tremendous benefit. The newer devices such as Nerivio and Relivon have wonderful quality of evidence, as good as any medication evidence. The earlier ones maybe not so well, but the new ones have wonderful quality of evidence. So I don't really think there's an excuse to not cover these for people with migraine and cluster. So here's a summary. On the left is Cefaly, the external trigeminal neurostimulator licensed in Ireland, available without a prescription, acute and preventive treatment. The STMS device, licensed in the UK, has a CE mark, acute and preventive treatment of migraine. The GammaCore non-invasive vagal nerve stimulator, licensed in the UK, CE mark. And I went through all of these: acute and preventive treatment of migraine, acute treatment of episodic cluster, and add-on preventive treatment of cluster. Nerivio, which is currently only available in the United States, the remote electrical neurostimulator on the arm for acute treatment of migraine. And then Relivon, which recently got cleared in the United States for acute treatment of migraine. So quite a lot, and more are in development. I have all sorts of slides hidden because there's so many coming. And I think that's a good time for me to stop and turn it over for questions. Thank you so much for letting me talk about this.
Thank you so much, Dr. Tepper. That was fantastic. And it's great to know there are many more devices underway, and hopefully in Ireland we're looking at getting some more as well for people.